It's a pleasure to be here today with Antoine Saunier from Toulouse. I am Piotr Musialek from Krakow. And what we would like to discuss with Antoine today is the role of cardiologists in the peripherals in 2018 and beyond. Antoine, we should be focused on the heart as cardiologists. Why? What's the reason to go to peripherals?
The main reason is that interventional cardiologists who are very interesting for the structural heart disease needs to have some information concerning the access, for example, because we are facing multiple access, and when you perform some TAVI, you will be able to solve any potential complications for the patients if you are really interested in peripheral arterial management, and if there is some tear in the iliac vessel, for example, if you are very comfortable for the brachial or for the contra-lateral access to get crossover, you will be more able, it will be easier for you to perform some sealing of the tear and to solve the complications for the patients. And I think it's really important for cardiologists. The second thing is that we are facing some polyvascular patients, and with polyvascular disease we have some interest for the carotid, for the critical limb ischemia, and it was the same patients we have to treat. That's why, in my mind, it's really important that the youngest cardiologist and mid-cardiologist will be involved in a peripheral program for the future.
So you indicate there's two reasons. One reason is because we face patients with multilevel atherosclerosis who require treatment in other territories to prevent stroke or to treat their intermittent claudication or threatened critical limb ischemia on the one hand, but on the other hand, this is not something elective, that this is something that you must, and we all must be familiar with, for the reason to be able to treat structural heart interventions. So is the transradial approach no longer enough? You know, everybody's been talking about it for the last years. We've all got used to transradial, and now are we going to be less comfortable having to go to other territories, or is there a way to be comfortable to do that?
No, I think that we need to be prepared to perform some transfemoral access with bigger inner diameter for the introducer. We need to be prepared to go by brachial access, because for peripheral, radial is not enough. And that's why it's really important to get the youngest more involved in the too much access than the transradial access. But Piotr, what's in your mind? What could be the best program for the beginners who wants to start a peripheral program?
Yeah, I think, of course, the best place is EuroPCR, and PCR offers a whole range of courses and sessions, both for the fellows as beginners, but I think the definition of the beginner is somewhat changing. It needs to be adapted to sometimes very senior cardiologists who enter, senior coronary cardiologists who enter structural heart disease interventions, and then they need to kind of go back and start their education regarding the peripherals and the excess, because as you mentioned, and I think it's very important, the first issue is to get there to the heart, to create your route to get to the heart, and the second issue is to safely get out of there, and ideally to have a fully, totally percutaneous procedure. And I have to say I've been impressed with the range of sessions this year and with the attendance of those sessions. The concept that have been developed by EuroPCR is to create a stress-free environment where anyone can come, people with a different level of expertise, with different experience, and this is the concept of sharing experience. So what we usually do is to use a recorded case, a live in a box case, but then this patient becomes the patient of all the participants in the room. And through sharing experience, we discuss the best strategy for this patient. It is not necessarily doing what people have done in the live case, but it is being able or educating people so that they become able to create their own procedure strategy for the patient that becomes their patient, and also to have a team discussion and to find out that sometimes there's more than one solution, and all solutions can work, can be right. What works in one hand is not necessarily what works in other hands. So I think this is a really unique environment that has been created to share experience. But what's the next step? Do you take people to Toulouse to get some practical hand-on?
The next step is if you want to start a peripheral program, you need to have the basics. Anatomy, indications, guidelines, and then after move to the cath lab and to the daily practice. And for the daily practice, we need a step-by-step approach for the patients. You have to consider different levels: aortoiliac, transfemoral, popliteal, below the knee. But at each level, you need to have the basics, and then after to conduct a safe, effective procedure, step-by-step approach. And that's why you need some dedicated cases outside your lab to think about material, to think about any potential complications, and then after to bring all information in your cath lab for the daily practice and to start your peripheral program by simple case to more complex cases, and sometimes you need the help of more expert physicians.
So what you get at EuroPCR through attending those sessions and through your active participation in those sessions is you get the knowledge that allows you to understand how far you can go on your own at this level and how to further increase your competence. But the one very important point that I think you have raised is the one on complications. Complications are rare, but the complications in peripheral can be life-threatening, and sometimes you have really seconds to save the patient or the patient would die. And one of the very important aspects has been the discussion of complications, how to avoid them, but also how to be prepared when the complications happen so that people are then comfortable with acting quickly. And as you mentioned, knowing what you need to have on your shelf before you start peripherals is a must, is crucial.
Yeah. Thank you, Piotr, and I think that we could conclude and hope so that as this year we could get into the EuroPCR program, the beginners course, and PCR peripheral for the next year. Thank you, Piotr.
The thing to remember is that the beginners are not necessarily we can have senior beginners in the peripherals. There's a unique mixture of people who come to the sessions, and it's all about sharing, isn't it? Yeah. That's the wonderful thing here.
Yeah, that's true. Thank you.
Thank you very much, Antoine. Thank you.